Happy Aloha Friday. We have made it to the end of another week. And Ryan, right now we've got a very important guest that we want to get straight to because we do have some big news this morning.
That's right. Joining us now from the Department of Health is Dr. Libby Char. Dr. Char, thank you so much for joining us this morning. We are getting reports of that very high number and that count for today. If you can take us through that number and explain a little bit of this count and what we're seeing.
Good morning. Thank you for having me. I just received word this morning that our count for today is 622 new cases. As you know, we had a data issues earlier this week, but if you take those counts and you look at the past 3 days, it would be an average of over 300 cases a day for the past 3 days. Certainly what we want to look at are trends, and we know from the past couple of weeks, our trends have gone from the 40s to the 60s to 160s to 200s and now 300. So very, very concerning.
As you project that out, where do you see things leveling off, or do you see them leveling off? Because 622, even taken into account that we have missed, some days in the past, that does sound pretty alarming.
Yeah, we're very, very concerned about it. We at this point, there's no real reason to think that the trend will change without us doing something different. I think the message remains, we know what works. The number one tool that we have for this pandemic is to get vaccinated. We know it's safe and we know it works. So get vaccinated, wear your mask. That's another tool that we know is absolutely effective. Keep your distance. And what we're seeing more of is that we need to remember is stay at home when you're sick. We're seeing more spread through people who have symptoms, even if they're minor, being out and about, going to work, mingling with family members and spreading the virus. So get vaccinated, wear your mask, stay home if you're sick, and avoid large gatherings.
I want to talk a little more about the calculations and what led to maybe this low reporting dates that we saw earlier this week and thus the higher number today. If you can take us through what happens in that process, and is that something that could happen again in the future? How do we find ways to minimize those miscounts so that we have a more accurate idea of these numbers each and every day?
So the way the counts come in, it's an electronic data feed from the labs. And I think part of it is just the high counts are really sort of indicative of, we've been tracking this every day and the numbers are coming in. And this pandemic has been going on for well over a year. And because we're trying to, keep up on it and release data in a rhythm that means it's coming out every day, it means that we really haven't had much downtime on the system to be able to do updates and whatnot. So it's a strain on the system as much as it's a strain on all the human beings and those that are using and interpreting the data. So we're definitely looking at it. We have it back online, but we're really trying to pay attention more to the whole system and not just, we got to get numbers out every day. Some of that may be that we go to reporting less frequently to allow for more downtime and system upgrades and whatnot.
Where are we seeing the most community spread right now? Is it, home gatherings? Is it restaurants? Where do you think is the sort of the riskiest place to be, if you will?
What we're seeing right now is just widespread community transmission. Certainly places where people are gathering, where they're not wearing their masks, that's definitely risky. And we're seeing transmission in social gatherings where people get together and they're eating and not wearing their mask. I think some of it too, we get together with our friends and we figure like, hey, they're our friends, we know them. So we kind of let our guard down a little bit. We've seen transmission from that. Definitely seeing transmission in places like restaurants and bars and just places where you don't have your mask on and you're in proximity to others, either working or socializing.
As we see these numbers, and I know what your response is going to be because we've had you on the show before, and you say that those are decisions for the policymakers. But as someone who helps to inform and educate the policymakers that make the decisions for the state, what are your thoughts about going back on some of the restrictions and implementing some of the things that have just been lifted that have helped to keep our numbers down earlier on in the pandemic? Do you think that we should be reinstating some of these earlier restrictions that we once saw?
So we have discussions as a team, as a Department of Health. There are a lot of really smart epidemiologists and biostatisticians and public health folks that have a lot of experience. And so we have discussions as a team. We tie in with the CDC folks. We have some really good partners on the federal level through ASPR and HHS. And so it's really not just me per se or our department. It really is a very, very team-oriented approach. And because we know that the transmission risk is greatest when, exactly people are gathering, not wearing your mask, in proximity when we let our guard down, those have been some of the conversations as to what would be useful. So, we would like to get a lot more people vaccinated. That makes sense. That's been shown to be safe and effective. And then also maybe to relook at gathering size, and just that we know that large gatherings are higher risk. And we advise the policymakers, but it really is a policy decision.
What do you think is an appropriate gathering size right now?
I think that's going to depend on the venues, whether they're social gatherings or professional or, work related. So I'm going to leave that up to the policymakers.
We have some questions, of course, that we'd like to bring in from the audience here. Stephanie's asking, have the changes to the Safe Travels program played a role in the current surge, or is it strictly attributed to the Delta variant? We know that there have been obviously some changes through the Safe Travels program with people now being able to upload their vaccination verification. With the cases that we're seeing in these counts, how many are attributed to travel and those entering our state?
That's actually a terrific question. I think the reminder to everybody is that the way the disease is being spread, no matter what variant it is that we're not wearing our mask, we're in proximity, we have unvaccinated people, 30-40% of our population is not fully vaccinated, and so that's how the disease is being spread. The fact that we have the Delta variant now just means that the spread is going to be that much more effective, that the transmission is going to be much higher because of the Delta variant. But really, it's about us protecting our community, and we can do things that we know will help, but we're letting our guard down, I think. As for travel, I think it's roughly 20% of the cases that we're seeing now are travel related. And that means either somebody who traveled, hopped on a plane and traveled, or for example, if I traveled and I come home and I then spread it to my household members would be considered travel related cases. I think there's also a big misperception that it's visitors that are bringing the cases in. And by and large, it is returning residents. It is residents who are traveling, who are getting infected, who are bringing disease home. And some of those people are traveling not being fully vaccinated, and so that confers even more risk.
There's big news out from the CDC today saying that the Delta variant is basically as transmissible as chickenpox, which we know is incredibly transmissible, and that people who are vaccinated can still spread it at a pretty high clip. Does that news today change the state's strategy at all?
Yeah, so the CDC messaging, I think, is just, this is a disease that's continuing to evolve, and so we learn more about it every week. Initially, the thoughts were that if you were fully vaccinated, even if you got infected, that you wouldn't be spreading any virus. And so now they're relooking at that, saying, well, is that accurate? Or if you get infected, even though you've been fully vaccinated, can you spread COVID? And so I think they're leaning more towards the latter. It doesn't necessarily change the strategy for what we're doing on a basic level, because it's still all the avoidance of getting infected in the first place, which is the distancing, the mask, wearing the vaccination, washing your hands, staying home when you're sick. But I think the CDC guidance has changed a little bit to say, okay, let's go back to wearing masks indoors, even if you've been vaccinated. And so that's one of the things I'm really happy that in our state, we never did let our guard down on that. We've maintained that restriction that we should be wearing masks indoors, even when fully vaccinated. So that's not a change for us. One of the things that did change, though, is to say that if you're fully vaccinated and you get exposed to someone with COVID, you don't need to quarantine, and that still holds, but you should get tested. on day 3 or 5 after your exposure, and that's new.
I want to focus in on the vaccine a little more. We know that the state was hovering at around that 60%. If you can give us an update on what you're seeing with these recent numbers, have you seen any improvement in that vaccination number going up? And your overall thoughts on where we stand right now with our vaccination rate?
If there are any silver linings to this pandemic and to the current trends, I think one of the things is, as we saw the trends start to go up and we were having those case counts of 160 a day and in that ballpark, we've seen vaccination rates and the demand for vaccine slowly going up. And so that's a good thing. We've been getting phone calls. I know the Big Island had a bunch of phone calls, and we've certainly around the state, people asking where they can go get vaccinated. And we've seen our numbers going up slightly to how many people are being vaccinated per day. So that's, if anything, is a good thing, that maybe it'll be sort of a wake-up call of sorts to really tell people now's the time. Don't wait. There have been over 3 billion shots given. We know this is safe. We know it's effective. Please go get vaccinated. We don't want anybody to have severe illness. We don't want anybody to die. We don't even want anybody to get infected, because everybody that gets infected runs the risk of having, long COVID or symptoms beyond just the infectious period. It's preventable. We just don't want our community to get sick.
We're trying to march to that 70% vaccination rate to then get rid of a lot of the restrictions that remain. But there are some health experts who now say that with the Delta variant, that 70% is no longer enough, that we need to get to 80 or even 90%, which seems pretty tough. What are your thoughts on that? Do you think that when we get to 70%, we will be able to lift the restrictions, or would you advocate for keeping them in place even at that level?
So the 70% was what we figured at the time would keep our community pretty safe. I think with the advent of the Delta variant, and knowing that it really is a good demonstration that the virus determines what herd immunity is and what keeps us safe, I think the numbers is likely going to be higher, that we will need more people to be fully vaccinated and protected against the virus in order to have a safe community.
We are just a few days away from opening up our schools once again. Judy's asking a question. Any sense of when our keiki can get vaccinated over and under 5? We know obviously that is one age range, but there are others, the under 12s, that are also still waiting. Any thoughts or updates that you can provide on when you think that might be approved?
Yeah, I don't have any specifics yet on when the vaccine may become available to those 5 to 11. I know that there's a lot of national buzz on that, and there are a lot of calls to the FDA asking when that might happen. I had heard that it would be late in the year, like November, December, and then I had heard maybe September, and now I'm hearing in late fall. So I really don't know. I know that they've been doing clinical trials for many, many months. But I think some of it has to do with when it's younger children, that we want to be extra cautious to make sure that the safety is there. Certainly, we're waiting, anxiously awaiting that release, because I think that'll make a big difference in our community. We would love to be able to get more people vaccinated.
Yeah, and to that point, Marcus has a question here. He says, why are we sending elementary kids back to school unvaccinated? Are you comfortable with sending kids back to school next week?
Yeah, I am actually. I think that's a fair question. It really is about trying to keep kids safe and do what's best for our community. I think what we have to remember is that there's a downside. The alternative would be months more of lost learning and social isolation for the kids. We know that it definitely takes a toll on them and their well-being. So I think it's a trade-off. Having kids in school, I'd be concerned about sending my kid back, but at this point, I'm very comfortable with it, and I think we've done a lot of things to make it safe. What the Department of Health team has been working very, very closely with Department of Education to put into place mitigation measures and just layers upon layers of what we can do to keep things as safe as possible. And so I think we have some good solutions that we've offered to the Department of Education, and I think they're listening and they're putting them into place. Not every school is going to be able to put into place every single measure, But the more that we can do, the more layers we can build, that's going to keep our kids safer. And one of the things that we have to remember as a community is that there is a population that's not yet eligible for vaccine, and that's the little kids. Well, then it becomes our responsibility as those who are eligible to get vaccinated. Everybody in that household, everybody who's 12 and older should be vaccinated to create like a safe bubble around those that can't get vaccinated. And that's our responsibility as a community, that things we can do to keep the young ones safe.
Of course, one of the concerning things about this Delta variant is the number of breakthrough cases that we're seeing for those who have been fully vaccinated. And I'm wondering if you can break that down a little more for us, the numbers that we're seeing here locally of how many of the current numbers, of course, that 622 reported today, but just a broader scope, how many of those are coming from these breakthrough cases that we hear about, and your thoughts and concerns about the variant still being able to break through those who are fully vaccinated?
So some of it is I think the bottom line is that the vaccine is safe and it works. And if you look at the number of people that have been vaccinated, the more people we vaccinate, that's going to statistically mean that we will see more breakthrough cases, because there will be a larger population of people who have been vaccinated. If you look at the numbers, I think right now it's still the number of people who have been infected after being fully vaccinated versus the number of people who have been vaccinated, right? If you get vaccinated, what are your chances of getting COVID? I think it still remains something like 0.06%. So we know it's safe. That being said, again, we're concerned about every human being that's getting infected. We know that your chance of being in the hospital, your chance of dying, your chance of getting severely ill, if you are vaccinated, you fare much, much better than those who have not been vaccinated. When we look at who's in the hospital, it's almost entirely unvaccinated people. When we look at those case counts and who's getting infected, by and large, it's the unvaccinated population. So even though we're seeing breakthrough cases, we shouldn't lose sight of the fact that the vaccines are safe and they are preventing illness. And the cases that we're seeing are largely unvaccinated people.
The Mayor Blangiardi, and others have said that they're not so much watching the case count as much now as they're watching the ICU capacity. Can you talk a little bit about our hospital capacity, what strain the new cases are putting on that, and sort of where we are in that metric and what your concerns are there?
Yeah, I think what we should be watching are a number of factors and not just any one thing. I think if we're just looking at hospital counts or ICU counts, that's a very late lagging indicator. And we know that from the point at which people get infected, they don't usually end up in the hospital until many, many days later. And if they're going to end up in the ICU, it's even a few days thereafter. So I think it's a very late indicator to look at. And just to say that we have more, available ICU beds, I don't think that's a really good solo indicator to say what we should be doing on a policy level. So I think we should be looking at the case counts. I think that's important, but really the trend is what's important, not the individual case count. So let's see what the trends are over the past 7 days or 14 days and what direction that trend is going. We should look at the percent positivity, because that tells us, are we doing enough testing? Are we seeing an increased disease burden in the community? So we should look at that. We absolutely should be keeping track of our hospital numbers, because that's a policy call, and we want to make sure that we're preserving hospital capacity so that they can continue to take really good care of those that need it for things like heart attacks or strokes or whatever else is needed, medical illness, chronic disease, that we want to make sure we're preserving our hospitals and protecting our hospital capacity, and to take care of those who end up with COVID. It's been concerning. We've seen our hospital admission numbers going up, and where we had seen 40, 50, 60 cases in the hospital per day, I believe we're up past 100 now, maybe 110 or so people in the state hospitalized. So that trend, again, we're watching the trends, and that's concerning. And I know the hospitals and the Healthcare Association have been having discussions, and they are very much aware and on top of it, and they're being very proactive about trying to make sure that we can take care of our community and provide that high level of care that we always provide.
We know that there's still discussions about a booster shot for those who have been fully vaccinated, about when that could potentially happen, and who would have to be those in line to get that booster shot if needed, looking into the future. As you think about that and the possibility that that booster shot could be needed, say, at the end of this year, maybe heading into next year, how do you think the state should handle that booster shot program, if you will? I mean, if you think about how long it's taken for people to get the vaccination shot and these centers that were set up in place, we saw Pier 2 as well as the Blaisdell and other locations to give out these vaccination shots. Do you think that for the booster shot, all of those types of platforms would have to be set up once again, or is this something that would just be done more at the convenience of, say, a local pharmacy?
So the booster shots that's an interesting question as well. I think there's some evidence coming out of Israel, especially as well as some of the other countries, that perhaps, especially in the older population, that your immunity may wane over time, and more so in the older population than in the younger population. So I know there have been conversations about, do we need a booster shot, and if so, probably focus more on the immune compromised and the older population. And so we're looking at it. We're definitely tapped into the federal side of things, and we're watching it very carefully. I think if we needed to do booster shots here, and we've already started, having those discussions and planning, it would depend on which populations. So if it was a very focused population on the severely immune compromised, that would be very different than if it was just a blanket call for everybody who's been vaccinated to go get a booster shot.
I want to go back to this idea that 70% of that perhaps not being enough. It really feels like we got the vaccine access, that people had it that it was widely available. And we had this sort of window of, in the last few months where things started to open up and life started to feel normal. And we were talking about this sort of post-pandemic era. And now with the Delta variant and the numbers that you're reporting today, 622 for those who are joining us late, it really feels like that window for herd immunity has sort of slipped away and that we are sort of sliding backwards. What are your thoughts on where we are right now?
Hard to predict where this whole pandemic will end up. I think, it's a good reminder to us that we are part of the world. And as long as there's a significant amount of disease in the rest of the world, it's going to be really hard for us as a state or even as a nation to isolate from that. So until the whole world has pretty decent control over this virus, we will continue to see spikes and spreads. We need to make sure that it's not just our state or our country that's protected. We need to make sure that we as a global citizenry have protection in order to tamp things down. I heard one of the epidemiologists talking about, this, are we in the second inning? Or are we in the seventh inning? I don't know. I would hope that we're in the seventh inning, but it's hard to say.
We are getting a lot of questions that are coming in here, but we do want to bring in a few more before we end. Audrey's asking, are we counting the people who are infected and recovered as vaccinated? Surely those people have developed immunity antibodies that one would think would be just as good, if not better, than the vaccine. We've heard the Lieutenant Governor actually on this program call for the fact that those who have recovered from COVID-19 should actually be counted towards the vaccination total as well if we're trying to reach that 70% threshold. I wanted to get your thoughts on those who have been developed these antibodies for the virus and if those should be counted.
So those who have had an infection develop antibodies against the vaccine and against the virus that they've encountered. They develop antibodies to it. We don't know how long those antibodies last. The other thing we know is that those folks are at risk for reinfection should the virus change significantly. So, for example, another variant. And we've seen that worldwide. What we do know is that when you get vaccinated right now, especially using the vaccines that we have in the United States, the level of neutralizing antibodies goes really, really high as compared to what you would have from a native infection. The other thing that's positive about the vaccine is that you get immunity from the variants that we've seen thus far. So if you get fully vaccinated, it protects you from wild type COVID, but we're also seeing pretty darn good protection against the Alpha variant, the Gamma variant, the Delta variant, the Epsilon variant, the Iota variant. So we know that the vaccination is really, really good right now to give you a more global and long-lasting protection. As far as looking at, sorry, I just lost my train of thought.
Counting that percentage of people toward the total.
Thank you. So when we look at that, if we've had 41,000 people in the state that have had infection, that does help in terms of us getting, how many people are immune, at least temporarily, from getting more cases. But that 41,000, how many of those people also have been vaccinated, which is what we've been strongly recommending. So, for example, the lieutenant governor had COVID, but he also got vaccinated. So I don't think it's 41,000 because we'd be double counting a lot of people. And when you look at it from just the standpoint of 41,000, it's not that significant compared to saying that, we have fully vaccinated 854,000 people and that 950,000 people have initiated vaccine. So it wouldn't really bump the percentage points that much, but absolutely if you've had COVID, that helps to prevent the future spread.
I want to bring in this question from Christine Donnelly, who writes the Kokua column. She's asking, this is policy, but I'm interested in your thoughts. What are the DOH recommendations in regards to Governor Ige for vaccine mandates for state workers in close contact with vulnerable populations, such as healthcare workers, prison guards, public school faculty, and staff?
So I think that gets back to, what can we do differently? What works? And I think number one, we said vaccine is the most effective tool that we have right now. I understand on the federal side, the president released his advice that the federal workers, it's not quite a mandate, but if you don't get vaccinated, then some sort of testing program. And I think that was also for the VA and for federal contractors. And I know that some of the healthcare systems have done it. Universities have done it. And I know that it's being discussed in the state along with the mayors. They're having discussions about that right now. And I think it makes sense for certain populations, especially when it becomes a safety issue, that we strongly encourage, incentivize, even mandate some sort of vaccination. I think it's absolutely worth having those discussions, and I think they are being had.
We're getting a lot of questions about some of the specifics with today's count, and I'm not sure that you know the answer to this specific question, but people were asking if we know the percentage of children that have been counted in that count that we saw today. Do you have any idea of what percentage of children are part of that?
Yeah, so I think for today, I think it comes out to be about 25%. I think, that's a really good point that you raised, because we're all feeling like, kids don't get it. This is a disease of adults, but we know that children are getting infected with COVID. We know that they're taking it home and passing it on to their family members, but more likely it's family members getting sick, passing it on to kids. But I think just for today's numbers, like roughly 25% of the cases of that huge number are in children.
And of those cases in the children, how are those cases playing out? Are we seeing them recover rather quickly, or do we see some of them having serious complications? Do we really know what happens to children? Can they get long haul COVID, what have you?
Yeah, I don't know the answer to that. I do know that in the hospitals now, we're seeing younger and younger people being hospitalized, certainly not children. I don't know the number for that. I'm sure there are children in the hospital, but we're seeing a lot more 30-year-olds and 40-year-olds being hospitalized, and that's a real big shift. And again, I think that's a testament to the vaccine. Early on, I think it's well over 90% of our kupuna were vaccinated, and I think that that's the result of that is that we're seeing less older people die. We're seeing less older people end up in the hospital or end up severely ill. We've had some deaths this week. I think we're up to 8 or 10 just this past week that have been added into the counts, and we're seeing younger and younger ages tied to those people who died.
Unfortunately, we have run out of time, but before we leave and sign off this morning, I did want to allow you just one final opportunity to have a message to our viewers here this morning. Of course, with this high number, many obviously are more concerned than we were, say, earlier this week when we thought those numbers were high. But just your final message for our viewers this morning.
Thank you. I appreciate the chance to talk to our community. This is going to be an all-of-community response if we're going to get a handle on this. It's not just the Department of Health. It's not just the healthcare workers. It's going to be an all-of-community response. Everyone needs to do their part. Get vaccinated. If you've been vaccinated, talk to your friends and your family members who have not been vaccinated. Go get vaccinated and do it now. Wear your mask. We know that that works. And especially when you're indoors, wear your mask. Avoid large gatherings. That's the other place that we know it's being spread. So get vaccinated, wear your mask, avoid large gatherings. Everyone needs to do their part if we're going to overcome this. Vaccines are safe and they work.
Dr. Libby Char, the Director of Health for the state of Hawaii, we thank you so much for being with us this morning and for sharing this rather grim news and putting it into context for us. We really appreciate it.
Thank you for the opportunity.
Thank you. Aloha.
Wow, Ryan, for those of you who may be joining us late, we just want to reiterate what the director said there. 622 cases reported today. That, of course, is some catch up from some partial reporting earlier in the week. But she did talk about the trends and saying, you know, when you average it out, we've gone from 40 to 50 cases per day on average to now around 300. That is very concerning. She said she doesn't see that trend necessarily slowing or stopping without more vaccinations taking place, and also those mitigation measures that she mentioned, like wearing a mask, social distancing, and avoiding large gatherings.
Yeah, obviously a concerning number, and it was great to be able to hear from her this morning to break down some of the reasons why we saw that large number. And while it is linked to those reporting discrepancies, it obviously shows and indicates that there is this spread that is happening in the community with the Delta variant. Also making note that they have seen an uptick in the number of vaccinations that are going up over the past few days. With when we saw these higher count numbers come through, the Department of Health is seeing a slow uptick in some of those people who may have waited to get the vaccine. They're seeing those numbers of those vaccinated going up to about 60.1% at this point right now. Of course, that benchmark of 70% continues to be the threshold, but we will wait to see what happens and if that benchmark gets moved even further with the numbers that we continue to see, and if those numbers continue to remain as high as they are.
Yeah, that was very significant. I thought that she indicated that 70% may not be enough. And we've heard, nationally health experts saying that with the Delta variant, that herd immunity likely won't be reached at 70%. So if and when we do get to 70% as a state, will we be able to lift those restrictions? That's not at all clear right now. Of course, she's emphasizing get vaccinated so that we can at least have that option. The other thing that she mentioned, and a lot of people are writing in there about schools and children, over 20% of the cases by her count are pediatric cases or young or people who are minors. That is very concerning. She did not know how many may be in the hospital, but she did say that that is concerning. That said, she still supports having school go back into session on Tuesday.
Yeah, and noting that it is important for those individuals who surround these students entering school to get the vaccination to be able to protect these students in a little bubble, if you will, to be able to protect them during this time when they are heading back to school. But no doubt, there's a lot of concern about some of these large gatherings that are happening in the community, and just hearing from her and her words of wisdom about refraining from any large gatherings, making sure that you are heeding the advice of wearing a mask and really just practicing good overall hygiene. So the message really has not changed from the Department of Health. Obviously, there is a lot more concern as this Delta variant continues to spread, though, through our community.
That's right. Joining us right here on Monday to add more to this will be Lieutenant Governor Josh Green. He, of course, is heading up the vaccination programs, also safe travels. So how do these numbers then, influence his decision making in that regard? We're going to be talking to him right here, 10:30 on Monday. Remember, if you ever miss one of these programs or you want to catch up, we are also available on television on KKI, Channel 50, later in the evening and then tomorrow morning, and then also as a podcast. So you can always download us and take us on the go. It's a great way to consume this content.
We also have an announcement before we leave that we wanted to encourage people to check out?
That's right. We have the Career Expo. This is sponsored by the Honolulu Star-Advertiser. This is happening on Wednesday at the Blaisdell Center, 9 to 3. If you are looking for a job, there are going to be plenty of employers there. You can pre-register online at hawaiicareerexpo.com. Remember, dress for success, resume in hand. It is free to attend, so please check it out if you or someone you know is looking for a job right now.
Yeah, all COVID-19 safety protocols will be enforced, which will include mask wearing, social distance, temperature checks, and proof of vaccination or a negative COVID test result. So make sure you pre-register again if you are interested in that. Looking forward to the conversation next week. We encourage you all to join us here again on Monday at 10:30. Until then, have a great weekend, stay safe, and aloha.
Aloha.